Welcome to the APD iConnect and EVV Implementation Orientation meeting. This session is being provided in anticipation of your transition to APD iConnect this week. Before we dive into the nuts and bolts of today's meeting, I do want to take a few minutes and just put your minds at ease when it comes to billing. There have been a lot of comments, questions, and concerns over the last several months about what the transition to iConnect will mean for you in terms of how, as providers, you'll submit your billing. So I just want to make it very clear. There will be no change to how you are going to submit your claims or billing right now. You will continue to bill like you always have via the FIMIS portal. When it is time for claims to go live in APD iConnect, there will be a lot of advance notice. There will be additional training. And so again, I don't want anyone to worry about that. You're going to continue to do your billing the way you have been doing it. What is going to change is how you document the service that you deliver. And when I say the service, I'm focusing solely on respite and personal supports right now. So again, no change to billing, take a deep breath, and then let's go ahead and talk about some of the other things that are coming. I also want to take a moment to address a couple of issues that have come up recently. APD is aware that on the Florida Medicaid web portal that there was an alert that was issued on November 24th announcing that providers needed to be using EVV by December 4th. That is specific to Medicaid managed care. That is not about APD iConnect. We did field several email inquiries about this alert, so I wanted to make sure that we addressed that today, that the 12/4 EVV deadline is specific to Medicaid managed care, does not apply to what we're going to talk about today. So don't worry in terms of iBudget services, you're not out of compliance because that alert does not apply to you. The other thing that was brought up by one of our providers that I wanted to make sure we address today is that some of you provide services to individuals on the iBudget waiver, and you also provide services to individuals who are on the CDC Plus. And so just wanted to let you know that CDC Plus has its own EVV system, so you will not be using the APD iConnect EVV mobile site for consumers that are on CDC Plus. So if you are a provider that provides services, respite and personal supports for individuals on CDC Plus and individuals on the iBudget waiver, then you will be working with two separate EVV systems. What we're going to talk about today is the APD iConnect EVV mobile site, and specifically how that's working for those consumers who are on the iBudget waiver. So now that we have talked about the things that today's session doesn't pertain to, let's dive in and get into the nuts and bolts of why you're here. First and foremost, some of you have sat in on other webinars, other calls, and so some of this information you may have heard before. But we have a lot of folks that haven't attended before, and so let's start with an update on our implementation schedule. One of the most exciting developments is that in October, we launched APD iConnect for two pilot groups of providers. One group was respite providers, and the other group was personal supports providers. And these two pilot groups have been successfully adding service logs for their consumers in APD iConnect for almost 2 months. That is so exciting. We've invited them to join us today, so many of them are on the call with us because those of you who are members of our pilot group, only the members of the pilot group, you're getting ready to add in the use of the EVV mobile site. So that's why we've invited you today. For the rest of you who are not part of the pilot group, you've been invited because now it's your turn to start your transition into APD iConnect, get comfortable with the application, in preparation for your eventual transition into use of the APD iConnect EVV mobile site. Just as a reminder, please stop by and check out additions to the APD iConnect e-learning library on a regular basis. You can see that we've got the link listed right here on the slide, so you have that quick reference. And then also, we've been adding a lot of information to the e-learning library over the last several weeks. Our most recent addition has been the multi-factor authentication page, the subpage that you can see here on the left. This will include information that you can use to learn more about ID Pass and how to get your access to APD iConnect. So again, make sure you check back on a regular basis because we've also been adding more videos and more documents for all of the basic things that you and your staff will be doing from the very beginning. This information is for those of you who were not members of our pilot groups of providers. Our pilot providers have already completed the ID Pass registration process. For the rest of you, you are invited to attend today because you've completed your training and you completed your ID Pass registration with your region. Now, in preparation for you to begin using APD iConnect, either later today or first thing tomorrow, you will receive an email that will look like the one here on the screen. This is your email that you will use to complete your identity proofing and finish setting up your ID Pass account. Once you've done all of that, then you will have your login credentials to be able to begin accessing APD iConnect. Couple of important points. When you get this email, one, be on the lookout for it because I've just told you it's coming. So if you don't see it, double check your spam folder, but this is the email that you're looking for. Two, when you click on the hyperlink here in the middle, you want to make sure that you have plenty of time because if you're inactive for more than 20 minutes, you will get timed out and then you'll have to request a new email and start the process over. The other thing to keep in mind is that this email will automatically expire in 5 days. So you want to make sure that you get this email and you complete the steps as soon as possible. One of the things that changed with the revision to the handbook is that once services go live in APD iConnect, so all of you that have been invited today, as of tomorrow, your services of respite and personal supports will be live in APD iConnect. And so per the new handbook, once services go live in APD iConnect, documentation for that service is required to be entered into APD iConnect prior to billing. So while I said at the beginning, and that's still true, there is no change right now to how you're submitting your billing, but you cannot submit your billing until you have entered your service logs into APD iConnect. So as of tomorrow, every service log must be entered for every single consumer that you serve in APD iConnect. And you can't do that until you complete this ID Pass process and set up your ID Pass account. For those of you who are agency owners, that ID Pass account is what you need to request access for your employees. So if you own an agency and you have 12 employees who go out and deliver respite and personal supports, they have to have access so that they can enter their service logs before you submit your claims. So this is absolutely important. This is your key to the kingdom, but you've got to make sure that you do it because the email will expire in 5 days and then you'll have to request a new one and the clock starts ticking in. All the while, you're not going to be able to submit your billing because you haven't put your documentation into APD iConnect. So again, be on the lookout for this email. It will be coming either later today or first thing tomorrow. For our agency providers, once you get registered with ID Pass and you complete that first login through ID Pass, you will then be able to go ahead and begin requesting access for your employees. So again, this only applies to the agencies. Solo providers don't need to do this. When you're requesting access for your EVV workers or your personal supports and respite workers, to say it differently, one of the things that you're going to want to do is use your ID Pass account to do that. You're going to request the service provider worker role for those employees, and you want to make sure that you request access to both the iConnect main application and the EVV mobile site. It's really important that you stress to all of your employees that they cannot share their login credentials with anyone else. Remember, APD iConnect is a statewide data management system, and that you as agency owners are bound by the HIPAA regulations and the Code of Federal Regulations regarding confidentiality. So you don't need to give this access to every employee, only the employees who need access to do their job. So for right now, we're looking at personal supports and respite being the services that will go live. Those are the only employees that you need to give access to. And once you request access for one of your employees through your ID Pass account, that employee will receive the exact same email that you received. So we added the screenshot in again because you're going to want to show this email example to your employees so that they can be on the lookout for it. They're going to click on the link just like you do, and they're going to have 20 minutes to not get timed out to complete the process just like you do. So again, if you need more information about the ID Pass system and multi-factor authentication, remember there is a subpage now in our APD iConnect e-learning library that is specific to multi-factor authentication and the ID Pass system. So let's take a few minutes and talk about what US providers need to have on hand in terms of equipment. And again, this is whether you're an agency or a solo provider. For access to the main APD iConnect application, you're going to need a device. And when I say device, that can be a desktop, that can be a laptop, that can be a tablet. You could potentially manage it on your cell phone, but that's really small to look at. So we would recommend something that's got a monitor, at least the size of the screen of a laptop or a tablet. And that device has to have internet access and a browser. In terms of accessing the APD iConnect EVV mobile site, you're going to need a mobile device. So in that case, not a desktop. And that mobile device needs to have internet access and a browser, as well as having the GPS location tracking enabled. Because remember, the primary purpose of electronic visit verification is to ensure that the services are being delivered where they're supposed to be delivered when it's a service that's provided in the consumer's home. So again, for that, you're going to want a mobile device. Now, I know some providers have homes where individuals live in supported living, and they may also receive personal supports, and the services always begin and end in that home where the individuals live. So one of the questions that we receive on a regular basis is, can we have just one device in that home and all of the staff will, and this is the language that we're hearing, clock in, clock out. You'll hear me say more often, start or end an EVV delivery. Same thing, clock in, clock out, start or end an EVV service delivery. If everything is happening in one location and you're not anticipating that there'll be any change of location, absolutely it's okay to have one device that's dedicated to that location. But for our staff that are going to go from Johnny's house to Susie's house to Karen's house to Joe's house, then they're going to need something that's more mobile. When we say mobile device, again, that could be a laptop, a tablet, your cell phone. And it just has to have internet access or a data plan and a browser. It is not appropriate for providers to use consumer equipment or Wi-Fi access. I'm going to say that again. This is really important. It is not appropriate for providers to use equipment or Wi-Fi access that belongs to the consumers. Providers need to have this equipment, and you need to be ready, which is one of the reasons we wanted to originally have the webinar, was to refresh your memory that you need to have this equipment up and running and ready to go when APD iConnect goes live for you. One of the really important things to remember is that with the new handbook that was recently promulgated, once a service goes live in APD iConnect, providers are required, per the handbook, to place all of their documentation for that service in APD iConnect before they bill. So that's a big change. And so what that means is that if you are a respite provider or a personal supports provider, once you're activated for APD iConnect, once it rolls out to you as a provider from that day forward, every single service log for respite or personal supports has to be entered into APD iConnect. Once EVV goes live, every single service log has to be entered through the APD iConnect EVV mobile site. So in order for you to be able to be in compliance with the handbook, you have to make sure that you have the equipment ready and that your employees know how to use it and access either the main APD iConnect application or the APD iConnect EVV mobile site. We do get lots of questions about, well, how do I know if the equipment that I have is going to work with APD iConnect? If you go to the APD iConnect e-learning library, to the main page, you will be able to see that we actually have a link where you can open and download the minimum system requirements document that you can then take to whoever manages your IT for your agency. For some of you, you have a contract with somebody who is your IT person. They manage these things for you. For others, it might be a friend that is just a little bit more computer savvy than you, that you can show them the document and they can say, oh yeah, I can set that up for you. That's really easy. We just need to turn this on, turn that off, those kinds of things. The really big thing that, because it's a long document, but the one thing to keep in mind that in the main APD iConnect application, you do want to make sure that you enable pop-up windows. That is really important because most links within APD iConnect open a new window. And if you don't enable your pop-ups, you can click all day and nothing will happen. So again, as agency owners, for the equipment that your employees are going to use, you want to make sure that all of the equipment meets the minimum system requirements and that your employees know how to use that. So if you've got one machine, make sure the pop-ups are enabled on the one machine. If you've got 6 machines, make sure the pop-ups are enabled on all 6 machines. Those kinds of things. Now, again, I just mentioned that one thing because I know that that's a really important thing, but you really do want to download this document so that you can see all of the minimum system requirements. Also, let's take a moment and talk a little bit about browsers. One of the things that you'll see in this document is that as of the date that this document was generated, and I want to say it was August or September of this year, the only browser that is certified compatible is Internet Explorer. And as many of you may remember from your training with your regional trainer, that was one of the things that they walked you through, is making sure that you were using Internet Explorer. APD iConnect will work with other browsers like Chrome and Edge and Firefox, but there are some things that may not work as well with those other browsers. So that's one of the things that you want to be aware of, is that if you are using another browser, that you may find some system inconsistencies. I can tell you that one of the things that WellSky is working on is making sure that APD iConnect is compatible with other browsers. So that's coming. Some of those little glitches that you might see in Edge or in Chrome, those are going to go away in the future. Again, you can use them now, but there might be some features and functionalities that don't work exactly as designed. So it is our recommendation that you use Internet Explorer until the other browsers are certified. In terms of the EVV mobile site and your mobile devices, the mobile site itself is not compatible with Internet Explorer. So there's a little bit of confusion there. We're saying that for the main application site, you need to be sure that you're using Internet Explorer, and yet for the APD iConnect EVV mobile site, we're saying don't use the Internet Explorer. The EVV mobile site has been tested and works well with Firefox, with Chrome, with Safari, and I'm not sure that we've tested it with Edge yet, but I do know with the others that it does work with those. So again, keep that in mind when you're looking at your mobile devices. You want to make sure that you're using one of the other browsers. For our Apple users, again, the system itself is certified compatible with Windows operating system, not so much the Apple operating systems. But again, if you're using something like the Chrome browser in your Apple system, you should be fine with that. So for our agency providers, in addition to making sure your employees know how to use the equipment, you will also want to make sure they know how to complete the steps that they need to complete in either the APD iConnect main application or the APD iConnect EVV mobile site. We have been building training material in our APD iConnect provider library that contains a variety of ways to train the same information. We have videos, we have documents, we do have one self-paced webinar that will walk your employees through step by step how to deliver an EVV service and access the EVV mobile site. In addition to that self-paced webinar, we have a document that then can be used by your employees to follow the steps and log into our training EVV mobile site and actually deliver an EVV service. So there's practical application as well as having documents, downloading them so that they have their own little training manual, or you as providers might decide that you want to have a group training with your employees, however you choose to do it, whether, because of COVID and social distancing, maybe you're scheduling a Zoom meeting or a Skype call or a Teams meeting, and you're pulling everyone together at the same time, or maybe a couple of groups at different times because people are out providing services, but you're having them watch the videos together, you're going through the steps together, and then they're also having an opportunity to do the practicing with the EVV service delivery afterwards. Or you could simply choose to give them the link for the provider library, and you could tell them what videos or documents they need to review and let them train themselves independently. Whatever works best for you and your agency and your employees. That has been left up to you, but we have put the material there in the library. Because we have a lot of material in our e-learning library and all of the various subpages within, I thought it would be helpful for you if I gave you the recommended order of modules and the location of those modules so that you can set up your own employee training. Again, however you choose to do it, whether it's a group training or they're each going to complete it individually. But this is the order that's recommended, because if you start on the APD iConnect Learning Resources page and you start with these two videos, the APD iConnect Basics video and the overview of the Consumer Central Record video, that will give everyone a good overview of just the nuts and bolts of how APD iConnect works. And then from there, you can transition to the providers library page where you can focus on things like how searches and filters in APD iConnect work. Most importantly, I know this is going to matter to many of you, how your staff will add their service logs. There's a video and a companion document. So if some people do better watching a video, they have that. If other folks need a little something on paper to work from, we have that companion document. And then the last item, which I mentioned earlier, is our self-paced webinar for how to use the APD iConnect EVV mobile site and deliver a service. This also has a companion document, and that companion document walks you through step by step what to do to actually log into our training EVV mobile site and deliver a service. So we put that information together for you. And again, this would be, think of it like a syllabus. This would be your syllabus for your employees training for APD iConnect. Some of you may have office staff, or you yourself will be coordinating the EVV activities for your business. In addition to the training modules that were listed on the previous slide, there are 3 other videos that you or that designated staff person will want to watch. And these focus on things like assigning EVV workers, because remember from your training, if you don't assign someone as an EVV worker for a consumer, when they log into the EVV mobile site, they won't be able to see the consumer. So that is one of your key starting places. And then the other videos that are available are how to review and your EVV activities once they're uploaded and justify any violations that may exist. And then the last one is creating a manual EVV activity. And that is what you will use in those instances where maybe the EVV mobile site wasn't available, there wasn't cell service, or there wasn't internet connectivity, or it was after a storm, those kinds of times where the service is delivered without logging in and accessing the EVV mobile site. So that video will walk you through that. Those 3 activities, assigning the EVV workers, reviewing the uploaded activities and justifying violations, or manually creating an EVV activity record, those can only be done by the person who has the provider EVV manager role. So again, that may be you yourself as an agency owner or solo provider, or you may have a person in your business who is designated to fulfill that role. So again, these are 3 additional training videos. You still would want that person or you yourself to watch all of the modules that were on the previous slide. For all of the providers who have already been through training, you know what the benefit is of that hands-on practice. So if you would like to have your training account reactivated so that you can share that with your employees so that they can practice as well, or maybe you yourself need a refresher, you can go ahead and send an email to the iConnectedAPDcares.org email address, and we will coordinate with your regional trainer to get the accounts reactivated for you and send you back the login credentials. That in this one instance, you can go ahead and use that one login and share it with your employees. Remember, in the actual live APD iConnect site, you're never going to share your login credentials. But for the training site, you can go ahead and do that. So we wanted to make sure that you have the ability to give your employees or yourself access to your training account so that you can practice before you start using the live APD iConnect site. We never, ever practice in the live APD iConnect site. That is live consumer data. That is their official client central record. So we never practice in the live site. We only practice in either the training site or the training EVV mobile site. Now, you've heard me reference the APD iConnect e-learning library, the provider library, several times through today's presentation. I do want to take a few minutes and just remind you that we have a frequently asked questions section, an FAQ section. We do want providers to check back and review those on a regular basis before you send inquiries asking, for example, how do you record services that are provided in a 1:2 or a 1:3 ratio? Check back to the FAQs first to make sure that that question hasn't already been asked and answered there. It'll be faster for you. As more and more providers are coming online with APD iConnect, we're going to be grossly outnumbered in terms of how many of us can answer your emails and your questions. So again, we are creating this place where you can get the information when you need it and we want you to go ahead and use that. So in just 1 second, I'm actually going to break away from this PowerPoint presentation and just go in and show you a couple of things on the FAQ site just to demonstrate the information that's available. And last, we just want to assure you that if you get stuck, we're here to help. If you have questions, if you're not sure how to navigate, we have our APD iConnect support desk, and the number is here. It is 1-800-353-5168. Write that down, put it on the monitor of all of your devices if that's what's going to help, but make sure you have that number handy. That will go to our call center where they will take your information, and they may be able to, depending upon what you're asking, they may be able to answer your question right there on the spot. However, if it's a little bit more of a technical matter, they may go ahead and just take information and pass that along through the help desk, and someone will follow up with you. We do ask for your patience in that because, again, there are a lot of you as providers. We are doing everything that we can to make sure that we have the resources available to be able to facilitate and assist you guys as you start using APD iConnect. But remember, using the provider library, using the FAQs, those kinds of things may get you the answers that you need so that you don't have to call this number. But if you do, we're here and we're more than happy to help. And with that, I'm going to go ahead and break away. We're going to take a few minutes and just take a look at our APD iConnect library and show you some of the FAQs. Okay, so that was our little video. And again, I like to record it. One, that way if we have any technical issues, the webinar can proceed. But two, we share this information with you all and post it to the website anyway. So I like to get the recording done in advance. I have been monitoring the questions as we've been going along. And so some of you, if I've not answered your question, it's because it's something that I think will benefit the entire group. So we'll go back through those. Those of you, if you have questions and you haven't posted them, please use the question box. We should have plenty of time to get through your questions today. And I also know that we have a couple of folks that joined late. So you may have questions that were answered before you joined us. If we have time, we'll touch on those. If not, again, this video webinar is being recorded along with the video, and that will be posted hopefully later today so that we have answers to your questions. But first, I just wanted to talk a little bit about, or a little bit more about the iConnect web pages and our e-learning library, because there's a lot of really valuable information here. And I want to make sure that you all know how to find it. So first and foremost, I mean, we can give you the link, but if you land on our public facing website, if you go to waivers, we have a link here for APD iConnect, and that brings you to our main APD iConnect page. On this page is where we are posting the minimum system requirements document, where you can just click on this link and download it so that you have it for reference. We also are providing information about our training and our implementation schedule. So that is our main landing page in the iConnect e-learning library. Some other things that have been added recently that I just want to make sure that I point out is we have recently added the multi-factor authentication page, which was referenced in the video. This is where you can see the documents and watch another video about ID Pass. All of you saw the video about ID Pass on day one when you went through training, your 5-day training with your region, but we posted it here so you have it again for reference, as well as the companion document that goes along with that. So click here if you want more information. That PowerPoint, as you recall, it has the different types of roles and what those roles can and can't do. Now, I do want to stress that not all roles are live, because some of the roles are related to billing. And as I said at the beginning, we are not changing the way that you submit your billing right now. So those roles are not going live. But that will walk you through how you finish setting up your ID Pass account. And then for those of you who are agencies, how you can go ahead and request access for your employees. I want to stress again, I know I said it in the video, I know I say it in this video here as well, but I just can't say it enough. As an agency owner, it is your responsibility to make sure that you only request access for people who absolutely need access to do their job. Again, claims is not live, so there is no reason to be giving any billing agents access. These should be just for your employees right now who provide respite and personal support services, because that's what's going live for you tomorrow. Other places that I wanted to mention, there was that one slide, and again, there's a handout for the PowerPoint in that video that we will send out to you all so that you have it, because there is that one slide that lists the order for you and your staff to review the information in the e-learning library to help you better understand all of the nuts and bolts of APD iConnect. So if you land on the APD iConnect Learning Resources page, here are the two e-learning modules that I referenced, the APD iConnect Basics and the overview of the Consumer Central Record. Again, this is really just very basic information. What's a tickler? What's a note? How do you add a recipient? What goes where in the consumer record? Those kinds of things. And then in the provider's library are the additional documents that are very specific to you. And when I say to you, I mean our pilot providers that are on today's call, as well as those of you who are getting ready to go live tomorrow. This important news link right here, very similar information to what you just saw, but this was the re-recording of the November 5th webinar where we had severe technical difficulties and I wasn't able to present the information. So it's all been re-recorded, it's right here. And then we have also been adding documents and videos and things like that. And so for those of you who asked, somebody asked a question, for example, how do I review documents after I upload them from the EVV mobile site? That information is captured right here in reviewing EVV activities and violation justification. So we have, based on feedback that we received from our pilot providers, we have added a lot more information to our provider library in anticipation of all of you going live tomorrow. So we wanted to make sure that you knew where that was. And then the FAQ page was the other page that I wanted to just drop in on real quick and just show you how it's set up based upon user groups. So you can go ahead and click on providers. And then within the providers FAQs, we've broken it down even further into subjects and topics. So let me just go ahead and scroll down so you can see all of these questions that we have here for EVV. A lot of you are have a lot of questions about EVV. So here are my suggestions. One, watch all of the modules in the order that's recommended. Practice using the training EVV mobile site. You can, as I said in the video, you can request that your training account be reactivated. We do ask that if you're going to send that request, you send it to iConnect@apdcares.org. And in that email, please list your name, the name of your agency, or if you're a solo, the name of your provider as a solo, and your email address so that we can look all of that up and get that information set up for you. We ask for your patience on that because there's just 2 of us that are managing that. And again, you guys grossly outnumber us. But if you want to have access to that for you and your staff, if you're an agency, we can assist you with that. Then the other thing that we suggest is that before you send questions, come here and check out. I mean, look at all of these questions that have been asked before you even got here. We have 29 questions. So if you've got questions specific to EVV, I do recommend that you come here. Some of these questions address specifically how to handle ratios. Some of these questions address what do we do if someone forgets to clock out, clock in. So we've put these resources here for you. I really do encourage you to use these resources. They're always here. You can always come back and check these things. And then the big question that I'm seeing in the question box today is when will I get my password? I don't have my password. I can't get in. And I went through that in the video, but I think some of you joined late. So I just want to, let me bring this over to this monitor here. So again, this was in the video that you just watched. You're all going to get this email later today, probably at the very latest, first thing tomorrow. But I think it's going to go out right after we finish the webinar today. Solo providers and agency owners, this is what you're going to use to finish your identity proofing and then to go ahead and set up your ID Pass account. From there, you will have your access into APD iConnect. Agency owners, once you've set up your ID Pass account, from there, you will be able to request access for your employees. Again, just the people who need access to do their job. And so that's you're going to look for this email. This is going to be the title, the subject line. Follow these instructions to complete registration for your new APD online applications account. This is what you're looking for. It may go to your spam folder, but we have not heard a lot of that happening. Again, this email expires in 5 days. So you need to get it and you need to click on the link and follow the steps from there. Also, remember, as I said in the video, once you click on that link, if you're idle or inactive for more than 20 minutes, you're going to get timed out and you're going to have to request a new email and start over. So that's for our new providers. For our pilot providers, you've already done this. Unless you're an agency, there isn't anything else that you need to do. You're set and you're good to go. If you're an agency and you have it set up for everything, for all of your employees, then you need to complete that. And I just got a message. It looks like the emails are coming tomorrow afternoon, so don't go and check your email today. Look for them tomorrow afternoon. And then the other thing that I wanted to mention to our pilot providers only. You know who you are. You've been putting service logs into APD iConnect. You've been manually creating EVV activity records. You know who you are. Here is your good news. Sometime within the next week, I don't have a definitive date yet, but be on the lookout because we're going to roll out the APD iConnect EVV mobile site to you. And how are you going to know? When you log in through Centrify, which is what you'll do once you set up ID Pass, for those of you who aren't part of our pilot group, you'll be logging in through Centrify. For those of you who are part of our pilot group, once you log in through Centrify, you're going to see a new icon on your Centrify dashboard. And that's how you'll know that EVV has gone live for you. So be on the lookout for that. We will send notification to our pilot members to let them know, but I just wanted to let you know it's coming and I'm so excited because this is just part of the process of piloting things. And you guys have done such a good job of testing the other functionalities, and now we're ready to test this one with you. So just wanted to mention that. So with that, I'm getting another message. It's no longer called Centrify, it's Idaptive. I apologize. So you're logging in through your Idaptive account. I'm going to start scrolling back through the questions and see if we can, we've got about 15 minutes. I want to go ahead and get through the questions. So let me scroll back. And again, if I responded to you individually, then it was a question that was specific to you. We do have a question of where to go for reviewing the recordings, and that is this e-learning library that I mentioned already, either on the APD iConnect Learning Resources main page or the providers library. So that's where you'll find that information and all of the videos that we've been talking about. And again, we've got several questions about the ID and how to get access and the password. I just went over that. I did have a question from one of you that I posted the answer to everybody, but I just want to say it one more time in case somebody missed it. For those of you who are going live tomorrow, meaning you're not part of our pilot group, the question was, are your staff, if you're an agency, required to be using the system tomorrow? And the answer is yes. If you have staff that provide personal supports or respite services, starting tomorrow, they need to be adding in their service logs in the consumer's record in APD iConnect before you submit your billing. So if you're not sure how to create a service log, we have a video for that, adding service logs to the consumer record, and we also have a document for adding a service log. So this is information for you if you've not done it before and you're just curious how it works, but also for your staff. We understand that some of you may have more staff that you need to get in and get them oriented. We were hoping that following the webinar in early November, many of you would have started that process of getting your staff trained, but we understand that many of you are going to start doing that today. What does that mean? That it's fine for them to deliver the service tomorrow and then come back after they're trained and add the service login. The difference is, as I said earlier, per the new handbook, once a service goes live in APD iConnect, so for all of you, tomorrow, Respite and Personal Supports is going live for you in APD iConnect. So once a service is live in APD iConnect, the documentation for that service is required to be created in APD iConnect before you submit your billing. Now, remember, you're still going to submit your billing via the FMIS portal, but before you do that, your service logs have to be entered into APD iConnect. And when I say entered, that means via the provider documentation tab in a consumer's record. You cannot keep them on paper and upload them as attachments to a note. You and your staff have to go in and create a service log in the consumer's record for each date of service before you submit that claim. All right, let me see what other questions we have. We do have a question about what if the claim was submitted before tomorrow? And that's fine. We're talking about from the moment you go live forward. So if you're providing services today, for example, you can still do your service log on paper or whatever way you currently do your service log, and you can still submit your billing today. But tomorrow, when you're live in APD iConnect, then your service logs need to be created before you submit that claim. We have a question that is specific to EVV about what happens if we take a consumer into the community for appointments, for community inclusion activities, while delivering respite or personal supports, because those are the two EVV services. We recommend that you watch the self-paced webinar for how to use the APD iConnect EVV mobile site and deliver a service. That will walk you through all of those steps. You record where you are when you begin and where you are when you end the service. So if you pick Susan up at home and you take Susan into the community, you're going to begin delivering the service at Susan's house when you pick her up. You're going to go on into the community to your appointments, all of the things that you normally would do. And then when you bring Susan home, you're going to end the delivery. But again, that's all covered in this video right here. Will caregivers input notes on the mobile EVV device? And the answer to that is yes. When electronic visit verification goes live for you, so for our pilot providers, we're anticipating that to be within the next week or so. For the rest of you, what we want you to do is get in and start using APD iConnect tomorrow, entering your service logs starting tomorrow, and then in a few weeks, we will roll the EVV mobile site out to you as well. So starting tomorrow, our new providers are creating service logs in the consumer's record in APD iConnect. For our pilot providers, in the very near future, you'll start creating your service logs using the EVV mobile site. For those of you when that happens, the question is, if you're creating the service log in the EVV mobile site, are you able to review them and follow up on anything if you need to once it's uploaded? And the answer to that is yes. Again, here is a video for reviewing EVV activities and justifying violations. So you're going to want to watch all of these videos. How do providers and support coordinators go back later in the month to read and print service logs? So here's the beautiful thing for those of you who are not part of our pilot group. Here's the beautiful thing about creating service logs in the consumer's record. As soon as you click save, the support coordinator will be able to see them. So you don't have to send that to the support coordinators. They have access to it. What you may want to do once you go live tomorrow in APD iConnect is reach out to the support coordinators and let them know that you're live and that you're entering service logs directly in APD iConnect. The other thing is that once EVV goes live, when you create an EVV activity in the EVV mobile site and then upload it into APD iConnect, as soon as you upload it, it's available for you as a provider in your provider record on your EVV activities tab, and it's also available for support coordinators in the consumer's record. So if you provide other services in addition to respite or personal supports like supported living, transportation, you're still going to need to send that documentation to the support coordinators. But your service logs for respite and personal supports, once you start creating them in APD iConnect, you do not have to send those separately or differently to the support coordinators. We do have a question of when does EVV go live? I think I touched on that. For those of you who are transitioning into APD iConnect tomorrow, it will be in a few weeks. For those of you who are part of our pilot group, we're hoping it's going to be within the next week. Some more questions about logins. I think we've touched on that. So we have a question from somebody who has a checklist that they do every day for their consumer, and you do their note once a month. Is it okay to upload the checklist? So in terms of handbook required documentation for personal supports and respite, you have to create a service log. I don't know if the checklist meets those requirements, but once you go live in APD iConnect, the only way to create a service log is by actually creating that record in the provider documentation tab of the consumer's record. So you can't upload something else. Now, you might be able to copy and paste from your existing document, but you still have to create the record in APD iConnect. There's some questions here about Edge versus Internet Explorer. And I know that for some of you, your computers may be set up that Edge is your default browser. And I said in the video that APD iConnect is certified compatible with Internet Explorer. You're able to, if you don't have Internet Explorer on your computer, but you probably do, you should be able to download it. You can do a Google search for how to set up Internet Explorer on your computer. I can tell you that APD iConnect does work with Edge. It's just a little bit glitchy, and there are some functionalities that don't always work. For example, you're not always able to open attachments on notes from within the Edge browser, but you can within the Internet Explorer browser. So again, download that minimum system requirement document, make sure that your equipment is set up per that document. And like I said, if you don't have Internet Explorer, you can do a Google search of how to download and set it up. And another question about, can all the information that we normally send to the support coordinators, you're still able to send that the way you always have been, the old traditional way up until tomorrow. Starting tomorrow, you're going to be putting those records into the consumer's record itself. So I have a question here about group homes are not required to do this, but what about in-home support homes? So officially, there is no such thing as an in-home support home, but I do believe what you are referencing is a home, a supported living setting where the personal supports are provided in that home. And if it's personal supports, it does make it an EVV activity. We do have a question out to CMS in terms of that 24/7 live-in personal supports, and will that be a required EVV activity, or can you document it as a traditional service log? So we are waiting for more information on that. We have a question about, is the APD iConnect main site going live tomorrow and not the mobile EVV site? That is correct. For those of you who are not part of our pilot group of providers, tomorrow you will receive the email to finish your identity proofing, set up your ID Pass account, and then using your adaptive dashboard, be able to log into APD iConnect. I have a question here of, what if you are a solo with employees and not an agency? I'm going to ask that person to reach out to your region. You cannot be a solo and have employees. If you have employees, you are an agency, so you need to get with your region on that. And there's a question about, when will the GPS tracking start? So that GPS tracking, that goes with the EVV mobile site. And again, what I said is that for our pilot providers, they will begin pilot testing the EVV mobile site, hopefully within the next week. For the rest of you who are not part of the pilot providers, you're going to be working in the APD iConnect main application for a few weeks, and then we will roll out the EVV mobile site to you. So there's a question about, if you provide both personal supports and companion services, how do you program this for the EVV for staff? Companion is not an EVV service. So what that means is that for the personal support service, you will be using, when EVV goes live, you will be using the EVV mobile site to document the personal supports. You will be using the provider documentation for the companion services in the APD iConnect main application. So the other thing to keep in mind, and I think this might be a little bit new for providers, because providers have not had the same access to the same system. This is the first time we've had a centralized system. So you will be creating your documentation based upon authorization ID numbers. Your companion service and your personal support service each have their own authorization ID. So you cannot deliver both services and create one service log for the two of them. They have to be documented differently. There's a couple of questions about billing. I'm going to pass over those questions because, as I said at the onset, we are not changing the way that you submit your claims at this time. And I know that we are right at 1 o'clock. I just want to scroll down to see if there are any other questions that I can touch on real quick. Most of these, it looks like we've touched on. There's a question about supported living coaching. Supported living coaching is not an EVV service. It is also not a service scheduled to go live tomorrow. You are going live tomorrow for personal supports and respite only. Yeah, it looks like most of these questions we've touched on already. There is one question about, and this is an excellent question, When inputting service logs in the iConnect system, do you put the entire week in or one day at a time? And that is an excellent question. It is one day at a time. You will create a service log for each date. So again, if you go and watch these videos, and I know we didn't have time to demonstrate, but you guys can go and watch these 2 videos right here, and they will walk you through the steps. You can also scroll, I think it's at the bottom, down in our video presentation section. For those of you that are in our pilot group, we also have the creating a manual EVV activity. But watch these videos, you guys. These are going to answer the questions that we didn't get to. For service logs, it is 1 date per record. So you're going to create a service log for December 7th. Then you're going to create a service log for December 8th. And again, our FAQs also answer those questions about, well, what if I have somebody that provides the service in the morning and a different person that provides the service in the afternoon? Do they use the same record? The answer is yes, but the details of how to do that is in the video and in our FAQs. So please go and watch those videos today. So there's a question about uploading documentation. We are not uploading any documentation. You will be creating provider documentation records directly in the consumer's record starting tomorrow. So that means if you're an agency, you will need to make sure that your employees have access to APD iConnect so that they can go in and create the service logs. And I know we're out of time, so what I can do is whatever questions we didn't get to when we send out the handout from the video earlier and the link for the actual video for today, we can also include any questions that we may have missed, but I have a feeling most of them are actually already in the FAQs. So if I didn't get to your question today, check out our FAQs to see if your question is there. I apologize that we ran out of time, but I do want to be respectful of people's time. So again, final word, be on the lookout for that email tomorrow afternoon and follow all of those steps to get your ID Pass account set up. That is how you're going to be able to get to the point where you have the adaptive dashboard, which for those of you who are not part of our pilot group, you will only have this one icon. This is the door to iConnect. This is how you get in. You can see your provider record. You can see your authorizations. From there, you'll be able to get to your consumers' records and those kinds of things. So again, I apologize that we ran out of time. We will go through all of these questions, make sure that we have answers for you. If there's something that you didn't get a chance to ask or you asked it and we didn't get to it and you just want to make sure that I don't miss it, you can send your questions to iConnect@apdcares.org, and Susan Appleton and I will be going through all of those and getting the information back to everybody. So I thank you for your time, and you guys have a great afternoon.